Welcome back to the show. Now, the African Palliative Care Association, we will be using the acronym APCA as we go into this conversation, and the Ministry of Health and Wellness of the Republic of Botswana will be hosting, that is, the 8th International African Palliative Care and Allied Services Conference under the theme 20 years of palliative and comprehensive chronic care for sustainable development in Africa. This will be at the Gaborone International Convention Center. So to tell us more on what this conference means, to, really overall what it entails, I am now joined, that is, on Zoom by Dr. Eve Namisango, who is the Head of Programs and Research at the association, as well as in studio we have, that is, Madam Echlin Uises. She is from Hope Home-Based Healthcare. So good morning, Madam Uises. How are you?
Good morning. Good morning, Namavia. We're good.
Good. Very good to have you.
Good.
Dr. Namisango, how are you this morning? Are you well?
I'm well, thank you. I'm delighted to be live on the show.
Fantastic. Happy to have both of you. I think maybe, Doctor, let's start off with you. You can maybe tell us why was there a need to come up with the association?
Thank you. It was important for us to come together as a continent and work towards improving the way we care for people with life-limiting and life-threatening conditions. And the African Palliative Care Association gives the continent one voice and gives the continent one strategy to ensure that we deliver the best quality for patients and caregivers.
Madam Uises, tell us, how did Hope Home-Based Healthcare become part of the African Palliative Care Association? When did this relationship start?
Well, it started in 2020. We were registered as home healthcare providers, mobile and private clinics, palliative and hospice care, a number of health issues, as we thought we want to be a one-stop shop that will provide comprehensive health care services. Me being a non-scholar in the health sphere, I needed different healthcare professionals to help me implement what is going on in my head, because I am just a caring being. I'm just an advocate. And it ended up that when I reached the Ministry of Health, they referred me to Dr. Rachel Freeman, now Professor Rachel Freeman at university. She's the specialist of palliative and hospice care in Namibia.
Okay.
And when I reached her, she introduced me to Dr. Eve Namisango under the African Palliative Care Association. And we became initially members to the African Palliative Care Association in 2023.
Okay.
We've been running, we're partners with NBC, we're partners with the university, we associate and collaborating with the Ministry of Health. Yes, we've made a number of groundwork so that we are strong and so we do not operate in silos.
Yeah.
So this is how we joined the African Palliative Care Association, and they recognized what we've been doing as a wonderful job and admitted us, and also promised that they would help to capacitate us.
Okay.
University as well has promised that they will provide us with training and capacity building.
Yeah.
So our service will not only be that of what we're doing currently, and for instance, myself, also to be qualified in some sort of formal training. So what I'm doing so far has been as good as that of a nurse, but now I need a qualification. So this is where the university and the African Palliative Care Association comes in hand in our lives.
I'm so tempted to high five, because I like this collaboration, but I'm not going to. Thank you so much for that, Ms. Uises. Doctor, can you describe for us how the association has fared since establishment, and also how many other countries are participating?
Yes, thank you. The association was officially launched in 2004. And since then, by the year, we are celebrating 20 years of service and impact in Africa. And since then, we have a lot of positive achievements to celebrate. We have close to 11 African countries that have standalone palliative care policies. We have 54 member states and close to 38 countries, there are no palliative care services. And even where there were no palliative care services, the training is going on. Very soon, those member states will be starting to deliver palliative care services. We have set up institutions that offer education and training in palliative care. An example being the Institute of Peace and Palliative Care in Africa. We also have palliative care programs run at the University of Cape Town in South Africa and others in University of Ibadan, Nigeria, and also at Nairobi Hospital, Kenya. Therefore, on the front of education, we have made substantial. And then talk about the issue of the lack of access to essential medicines for pain and other symptom management. I'm delighted to note that in close to 12 African countries, the morphine is being reconstituted locally. And I want to say that in partnership with the University of Navarra in Spain, we have been working on mapping the development of palliative care in Africa. We are to date, and this atlas is going to be launched at the African Palliative Care Conference. I don't want to share the findings before the conference, but I want to assure you that the continent has made steady fast progress. And I also want to say that the 48 African countries are members of the African Palliative Care Association. We have footsteps there. And before 2026 ends, we shall have footsteps in the 54 member states of the continent. Thank you.
Fantastic. Thank you so much, Doctor. Madam Moises, how would you describe palliative care in general in Namibia? Would you say it is something that people are embracing more and more every day?
I think I would say palliative care probably existed already. It's only the term palliative care that was not very much known or used. Because when I started, we've been doing everything that encompasses palliative care. But we did not know till Professor Rachel Freeman said, what you're providing is not only home-based care, you're actually providing palliative care. And I think in our small space, we've been the first persons in Namibia that really spoke out about palliative care. I'm very, very compassionate about it. I'm a very strong advocate. I want the best possible services for every person that needs it. So palliative care is integrated. On the ministerial level, it still needs quite a lot of work out, but the ministry also has had, I think, some sort of a committee that has been interviewed either in 2024 or 2023 in this very studio. And yes, we were on work last week, Monday. We had a meeting with our beautiful young Honorable Dr. Esperanza Lubindao, discussing the Hope Home-Based Healthcare, introducing it. And we also shared with her the invitation to Botswana, since it's very, very important that our national leadership knows we're going to represent Namibia. We're not only going as Hope Home-Based Healthcare. We're going to represent our country. So we needed to be on the same page with our minister. She's new in this in her department, but she still needs to know what people that she leads is up to. And yes, the minister is unable to join us on the trip, but we will be there, and we shall not only be there for hope, as we said, we are going to represent our country.
Yeah, yeah. You know, speaking of which, the conference is on the 22nd. Did we say 22nd?
Yeah.
That's Monday.
Yes.
That's on Monday. That's around the corner.
That's a few sleeps.
There's a few sleepies if we counted it down. So I wanted to ask, one, how do you intend to participate at the event overall? Apart from like you said, you're going to represent Namibia holistically. Two, I know there's always a concern for funds, right? So what would you like to say to possible, and I specifically think corporate Namibia can also come on board, you know, how would you appeal for them, you know, to come on board and, you know, support in this instance?
It is a very short notice, but we appreciate the platform that NBC created for this interview this morning, because this at least gives us to reach any person that would like, or any corporate that would see importance in what we're doing, to join hands. Of course, we are a non-profit organization. We'll be a team of 7 persons that will be traveling. So we would need, if people can come up and fund us 50,000 or donate, we'll be very pleased. It will help us. Yeah. It shall help us, because we'll be there for a whole week. And in many instances, what we currently, it will be our first. This is our first most important milestone to be recognized by the African Palliative Association. It's not a small feat. So going out there, we said it is our first time to attend this magnitude of event. Can we go out to learn, to form partnerships, to form collaborations? There will be experts in various fields, and we need these people to look at what we have done thus far and put us on the right path, so that we are more a benefit to our country on our return. And the partnerships in any collaborations and memorandum of understandings that we might go and pick up there should not only be for hope, it should be for our country. I would definitely not want to go out there and play the only girl. I would want my young and vibrant minister to pick up her own partnerships and collaborations after this. So we're going out for our country, and we're very proud, and we're really calling on every institution or corporate that would love to support us to please get in touch with us and offer us the support, because we need to be in Botswana on Monday morning, and we need funds.
Yes,
we
absolutely.
do.
I understand. We understand. Thank you, Ms. Wises. Dr. Namisango, we are out of time. If we can just ask you for your final thoughts, final inputs, which we'd appreciate that.
Yes, thank you. My final call out to all listeners and partners. We urge you, please subscribe and attend the 8th African Care and Allied Health Sciences Conference. This is a specialty in medicine that all of us need. The children need it, the adults need it, older persons need it, and all disciplines need it. So please support us. Come attend this important conference.
Thank you so very, very much. Madam Wises, it was nice having you in studio with us this morning, and all the best. I know you're going to represent us and, you know, wave that flag all the way up high. Thank you for being here.
Kudos. Thank you, Namibia. Thank you, NBC, for having us here again and again.